My name's Tessa, and we're going to be going over the appendicular skeleton. The pectoral girdle is made up simply of the scapula, which is our shoulder blade, and the clavicle, which is our collarbone. So the scapula is part of the pectoral girdle. The scapula is broad, somewhat triangular bone on either side of the upper back. The coracoid process curves anteriorly and inferiorly to the clavicle. This is the attachment side for the upper limb and chest muscles. The glenoid fossa lies on the head of the scapula between the processes and articulates with the humerus. This is our spine, where you want to hold it when you pick it up to look. The spine divides the posterior surface of the scapula into uneven parts. Above the spine is the supraspinosus fossa, which holds the supraspinatus muscle. Below the spine is the infraspinosus fossa, which holds the infraspinatus muscle. The acromion process lies at the head of the scapula at the lateral end of the spine. This forms the tip of the shoulder. The scapular notch lies on the superior border of the scapula end, medial to the coracoids process on the anterior aspect of the scapula. This forms a foramen with the superior transverse ligament. It's a passageway for the suprascapular nerve. Note: a mass in the notch can lead to atrophy of the supraspinatus muscle and infraspinatus muscle. The axillary border, also called the lateral border, directed towards the arm, is posterior to the axilla. The vertebral border, also called the medial border, lies about 5 centimeters from the vertebral column. Note: also has a superior border on the superior edge. So the clavicle, a collarbone located on the base of the neck, run horizontally between the sternum and the shoulders, which is the scapula. Medially articulates with the manubrium and laterally with the acromion process of the scapula. Braces the scapula and helps hold the shoulders in place. Provides attachment for muscles of the upper limbs, chest, and back. It's structurally weak, therefore easily fractured if compressed lengthwise. Only direct contact between the pectoral girdle and the axial skeleton. Next, we move to our humerus. The humerus is our arm bone. It is the longest bone of the upper body, and it extends from the scapula to the elbow. The head of the humerus lies at the proximal end of the humerus. It's smooth, rounded, and fits into the glenoid fossa. The capitulum is a smooth condyle knob-like structure on the lateral side of the humerus. It articulates with the radius at the elbow. The trochlea is a smooth condyle. It's a pulley-like structure on the medial side of the humerus. It articulates with the ulna at the elbow. Then, olecranon fossa, a depression that lies at the distal posterior aspect of the humerus. It receives the olecranon process of the ulna when the upper limb straightens the elbow. Glenoid fossa is a depression that lies at the distal anterior aspect of the humerus. It receives the coronoid process of the ulna. Okay, now we're going to go to the radius. This is the lateral thumb side bone of the arm when you're looking at it anatomically. This is shorter than the ulna, as you can see. It extends from the elbow to the wrist and covers over the ulna when the hand is turned so that it faces backwards. The head is a thick disc-like structure at the proximal end of the radius. It articulates with the capitulum of the humerus and a notch of the ulna, which is the radial notch. This is our radial tuberosity. The radial tuberosity lies on the radial shaft just below the head. The attachment site for the biceps, brachii muscle, which bend and flexes the upper arm at the elbow. The styloid process lies at the lateral distal end of the radius. It's attachment site for ligaments and wrist. Now we're going to go to the ulna. The way I kind of remember this is it looks like a U. This is our medial bone. It's longer than the radius, and the head of the ulna lies at the distal end. So the olecranon process is here. It's located above the trochlear notch. It lies at the proximal end of the ulna and provides attachment for the triceps brachii, which straightens the upper limb at the elbow. During this movement of the olecranon process fits into the olecranon fossa of the humerus. The trochlear notch is here. The trochlear notch, called the semilunar notch due to its U shape, it lies at the proximal end of the ulna and it articulates with the trochlea and the humerus. The coronoid process lies just below the trochlear notch. This lies at the proximal end of the ulna. It fits into the proximal coronoid fossa of the humerus when the elbow bends. The styloid process is the pointed end of the ulna. It lies on the medial distal end of the wrist, and it provides attachment for ligaments of the wrist. Carpals consist of 8 bones in 2 rows, 4 in each wrist. The metacarpals have 5 in each hand. It lies in line with each finger. It articulates proximally with the carpals and distally with the phalanges. The head of the metacarpals is distal, forms the knuckles. Lateral metacarpals most freely movable. It permits opposition. How are they exactly numbered? It goes from your thumb outward. Thumb is 1, then 2, 3, 4, 5. This is the pelvic girdle. It is made up by the sacrum and the pubis, and that's right here, and the os coxa, which is this portion right here. So next we will be talking about the os coxa, which is one of the 2 hip bones. It is composed of the ilium, ischium, and the pubis. The ilium is this uppermost portion here, the largest and most superior portion of the coxa. The smooth concave surface on the anterior aspect of the ilium is the iliac fossa. This articulates with the sacrum at the sacroiliac joint on the right here. The iliac crest is formed by the superior portion of the ilium, where it flares outward. This is forming the prominence of the hip. The greater sciatic notch is here. Is a deep indentation in the ilium below the iliac crest, the passageway for the sciatic nerve. This is the lesser sciatic notch. And this will cover your portion for the ilium. So the ischium forms the lowest part of the coxa. It is L-shaped. It's this portion right here. The ischial tuberosity is right here. Is the angle of the ischium, points downward and posteriorly, and provides attachment for ligaments and lower limb muscles. It supports the weight of the body when sitting. The ischial spine is right here. The ischial spine lies above the ischial tuberosity near the junction of the ilium and the ischium. May be felt during vaginal examination, used as a guide to determine pelvic size. The distance between the ischial spines is the shortest diameter of the pelvic outlet. So now we come to the pubis, which constitutes for the anterior portion of the coxa. The 2 pubic joints anteriorly and form the symphysis pubis, a fibrous cartilage. The acetabium means vinegar cup, a concave socket that articulates with the head of the femur. All 3 bones of the os coxa meet here. The obturator foramen lies between the ischium and the pubis. It is the largest foramen in the body, and obturator foramen covers and nearly closes this foramen. This is the site of attachment for the hip bones. This is our femur. The femur is the thigh bone. It is the longest bone in the body. It extends from the hip to the knee. So we're going to start off. This is our head. The head is the large, rounded at the proximal end of the femur. The neck is a constriction just medial to the head, most common site for a fracture to the femur. This is our greater trochanter, a large process which lies lateral to the neck, easily palpable, provides attachment site for muscles of the lower limbs and buttocks. The lesser trochanter is a small process which lies medially and inferior to the greater trochanter. It provides attachment site for muscles and lower limbs. The medial condyle is on this side, is located medially at the distal end of the femur, and it articulates with the tibia. The lateral condyle lies laterally at the distal end of the femur. It articulates with the tibia as well. The intercondylar fossa lies between the medial and lateral condyle. It's visible on the posterior view of the femur. This is our patella. This is the kneecap. It's considered a sesamoid bone. It is flat, located in a tendon that passes anteriorly over the knee. And this controls the angle at which the tendon continues towards the tibia. Okay, so now we're going to move to the tibia, which forms the leg knee to the ankle. This is the second largest bone in the body, the large medial bone of the leg. The anterior crest. The anterior crest is a prominent ridge which lies anteriorly and attaches connective tissue in the leg. The medial malleus is a distal prominence on the medial side of the tibia. It's an attachment for ligaments. The distal end articulates with the talus, which is the large ankle bone. Then we move to the fibula. The fibula is the long, slender lateral bone of the leg. It does not bear body weight. The head does not enter the knee joint, and the lateral malleus is right here at the very end, comes outward. The lateral malleus is a distal, slightly enlarged lateral prominence. It articulates with the ankle and protrudes laterally. We're going to go over the tarsals, which consist of 14 bones, 7 per feet. The calcaneus is this portion right here. The calcaneus is the largest of the tarsal, located below the talus, where it projects backward to form the base of the heel. It helps support the weight of the body and provide an attachment for the muscles that move the foot. This portion here is our talus. The talus lies superior to the calcaneus. It can move freely when it joins the tibia and fibula, where it forms the ankle. The metatarsals are 10 bones, 5 per foot. It forms the instep, and it articulates with the tarsus. It forms the arch of the foot, and it's numbered 1 through 5, beginning on the medial side. 1, 2, 3, 4, 5. And you use Roman numerals for these. The phalanges is 28 bones, 14 on each. The 3 bones in each toe is the proximal phalanx, medial phalanx, and the distal phalanx. The great toe, or the hallux, lacks a medial phalanx, as you can see.